Hello, my name is Dr. Christopher Stralka, and I'm the Medical Director for Julia Hospice and Palliative Care. Julia Hospice and Palliative Care will be a new provider of both hospice and community-based palliative care services in Erie County, Pennsylvania. It is my pleasure today to welcome you to the first of a series of short informational webinars addressing important topics in both hospice and palliative care. And where we can, we're going to try and relate the information presented to specific services and features of our healthcare agency, Julia Hospice and Palliative Care. Without further ado, let's begin our webinar today entitled, Why is an Inpatient Facility Best? At the completion of the webinar, we hope everyone will be able to define and list the important features of a hospice house and be able to describe how a hospice house differs from other long-term care facilities, such as a nursing home, and be able to differentiate between an inpatient hospice facility and a residential hospice house. And lastly, be able to describe the important elements of our Julia house, which when built and opened will be the very first inpatient hospice facility ever in Erie County. Today we'll be talking about hospice and hospice care, and by hospice care I mean specialized end-of-life care. And we'll be talking about palliative care, and by palliative care I mean supportive care that focuses on the quality of someone's life. So what is a hospice house? Many people have heard the term, may have even been in a hospice house. It's a freestanding structure. It's not connected to or part of any other healthcare facility. It is specifically designed to look and feel like someone's private home, and it's usually in a rural setting that is peaceful and serene. Oftentimes, a hospice house is someone's private home that's been gifted to a hospice agency and converted into a hospice house where hospice patients can be cared for. We know that patients at the end of their lives would prefer to be in their own homes and be surrounded and cared for by their families. But the reality is that that's not often possible because either patients don't have a family member that can be their hospice caregiver, or they don't have the resources to safely stay in their own homes or place of residence. The hospice clinicians at the hospice house are available 24 hours a day to come to the hospice house and provide care to the residents of the hospice house, or they're even on site most hours of the day. The hospice house often provides special amenities to help families continue to make special memories together, like kitchens to prepare meals, dining areas, and family spaces to share special celebrations. This is a photo of the Blair House in Warren, Pennsylvania, which was the private home of John and Orpha Blair, who gifted their home to the Hospice of Warren County, and they converted it into a 3-patient residential hospice house. The rooms are large and can accommodate even large families. The rooms have special attention to detail and provide connectedness to nature, both inside and out. Bedrooms rather, can be large enough to be reconfigured to allow for a folding bed or a cot so that family members can stay with their loved one overnight in the same bedroom. Hospice houses are much different than nursing homes. The rooms are all private, single rooms with private bathrooms. The clinicians at the hospice house are either specially trained or experienced in end-of-life care, unlike the staff at a traditional nursing home. Complementary care services are often available, and family care services like bereavement care and grief counseling, complementary care like music and art therapy or exercise therapy. The focus of the hospice house is to preserve one's dignity and to provide personalized care that fosters a sense of well-being or health and happiness, unlike the nursing home, which often is an extension of the hospital and has a sterile or clinical feeling, focusing mainly on patient safety, and often at times makes the residents feel institutionalized. Not all hospice houses are the same. The small residential hospice houses we've been talking about provide, for the most part, routine hospice care, which is not 24/7 care. The care is often delivered by a licensed practical nurse. But we know that hospice patients often can develop a crisis, either uncontrolled pain or other symptoms, or situations where being able to care for that individual at their chosen place of residence is just not possible. And it would be preferable to move the patient to a facility where a higher level of care would be offered. The type of care we're talking about may require intravenous medications, non-invasive breathing support, or other more intensive interventions. This type of hospice care is referred to as general inpatient hospice care, and it can only be provided in an inpatient hospice facility where trained and experienced registered nurses are available and providing the care 24 hours a day. The general inpatients can be seen daily by a hospice physician, in contrast to patients who are receiving routine hospice care that may not actually meet or see their hospice physician until it's time to recertify the Medicare hospice benefits after the first 6 months. The inpatient hospice facilities, because they're larger and provide more intense levels of care, require special state license and are under greater state and federal regulation. And again, the inpatient hospice facilities tend to be larger than 3 beds. This is a photo of the inpatient hospice facility, or the hospice house, owned by Hospice of the Valley in Poland, Ohio. It is a 28,000 square foot facility with large, expansive spaces to accommodate multiple families. Special rooms like libraries or reading rooms, child care areas. The individual patient rooms tend to be larger and can accommodate multiple family members at the same time, and even accommodate multiple family members that would want to stay overnight with their loved one in the same room. So what will the Julia House be like? Well, the Julia House will be owned and operated by Julia Hospice and Palliative Care, and it will be, once it's constructed and opened, the first inpatient hospice facility ever in Erie County, Pennsylvania. It will be able to provide routine hospice care for residential patients staying there and general inpatient hospice care for those requiring crisis management. The staff will be specially trained and credentialed in hospice and palliative care, so that when the Julia House opens, it will be the only facility able to achieve national accreditation in both hospice and palliative care and meet the highest qualities of national qualities for standards of hospice and palliative care. In keeping with the mission of Julia Hospice and Palliative Care, all of the services will be available to anyone needing them and anyone eligible for the care, regardless of their ability to pay for the services. We know that there are residents of Erie County that don't have health insurance or may not be enrolled in Medicare or Medicaid and don't have the personal resources to pay out of pocket for this type of specialized care. To us, anyone needing the services should have access to them, and no one will be turned away, regardless of their ability to pay for the services. Julia House will be the first and only outpatient palliative care clinic in Erie County right now, Palliative care services are limited to inpatients at the 2 major hospitals. And we know that in Erie County, as many as 10 to 15,000 people are living with a serious illness and struggling to manage their illness, and may even be mildly debilitated and would be in need and benefit from palliative care services in the community. So Julia Hospice and Palliative Care will be the first provider of these services, starting with our outpatient palliative care clinic at the Julia House. The Julia House, the planned site, is located in McCain Township on West Road, very close to the I-79 interchange. This is a conceptual floor plan of the Julia House. This particular floor plan is between 15 and 16,000 square foot facility. The entire facility would have the capacity to care for as many as 18 hospice patients at any one time. It would also be the administrative offices for the healthcare agency and be the location of the palliative care clinic that would also be equipped for telemedicine. This is a computer rendering of the exterior of the Julia House based on the floor plan. We have hired an architect and engineering firm that is currently working on the conceptual floor plan and designs for Julia House. When these become available, we will share them with everybody on our website, juliahpc.com. In summary, today's webinar has provided much information, including that there are hospice providers in the neighboring communities that own and operate their own residential hospice houses, that a hospice house is much different than other long-term care facilities like a nursing home, that inpatient hospice facilities are even more than smaller residential hospice houses, and can provide the highest levels of hospice care. And that the Julia House will be a special facility unlike anything else in Erie County. It will be the first inpatient hospice facility capable of providing both residential hospice care and general inpatient hospice care. That ends today's webinar. I thank you for your attendance, and I encourage anybody that has any thoughts or ideas regarding what we're doing, or ideas for future topics for our webinar series, to visit our website, Julia HPC, and leave us a comment or send us an email at julia@juliahpc.com. Again, the website will be a place where anyone interested can go to access our webinars by clicking on the appropriate YouTube link, and it will take you to YouTube where you can view our webinars. We're also in the process of putting additional educational material, topical information on our website, and we're working on a frequently asked questions page as well. So again, we thank you for being with us today for our first webinar. Have a nice day.